Hi there, this is Dr. Terrence McCatton from West County Plastic Surgeons of Washington University in St. Louis. And today I'd like to address a common thing that shows up in the office, which is deciding between a tummy tuck and liposuction. So how do you decide? Well, there's several different factors here when considering this. So essentially, what liposuction does is it essentially spot reduces areas of focal fatty tissue. And it's best used when somebody's already in good shape, somebody who has already done due diligence with diet and exercise to reduce their weight, and there's some persistent, stubborn areas that they cannot fully address. And so liposuction works well to go after those areas. What liposuction doesn't do well is address areas with a lot of loose skin. Further, it does not tighten muscles, and beyond that, liposuction is not a strategy for weight loss. Tummy tucks are a little different. So tummy tucks essentially are best used when a patient, very often women who have previously been pregnant, had the sudden weight fluctuation with gain and loss with pregnancy, who have developed a fair amount of loose skin, oftentimes stretch marks between the belly button and the pubic area, an overhang, almost like a ledge of skin that develops in that area. That skin tends to be a little bit more loose, a little bit more flaccid. It doesn't have a lot of sort of density to it. Oftentimes, those women will often have also a separation of their six-pack muscles that we refer to as a diastasis. So those patients are really good candidates for a tummy tuck. Men can also have a tummy tuck. That is also very common in men and women who've had weight fluctuation for reasons other than pregnancy. So somebody was heavier in the past through diet and exercise or weight loss surgery, have lost a considerable amount of weight, and also have developed some loose skin. In effect, in their abdomen, their skin suit is a little too big for their belly or for their frame. And so that patient would be a good candidate for a tummy tuck. In a tummy tuck, briefly, we are removing that excess overhanging skin. We are often tightening the muscles. Specifically, we're bringing the six-pack muscles, which separated with pregnancy or weight gain, we're bringing them back together. So that's called a rectus plication. And because we're removing that skin, and oftentimes we're moving skin from the belly button to the pubic area, of course, we don't want to drag that belly button down too far. So we're also essentially what we call translocating, or keeping the belly button in the same position while moving all the skin around it. So tummy tucks end up with a scar around the belly button, as well as a sort of a flat or more semicircular scar just above the pubic area. So again, liposuction more for spot reduction of stubborn areas. Tummy tucks more for, yes, it removes fat, but it also removes some excess skin and can tighten muscles. And of course, we can do them together. Sometimes we do a tummy tuck for the front, we do liposuction for the sides or the flanks or the bra rolls. Often if we're working all the way around from the abdomen at the front through to the flanks and through to the back, sometimes people refer to that as 360 lipo. Essentially all that means is that we're contouring 360 degrees around the frame from back to front. And of course, liposuction can be used in lots of other areas, common areas being the outer thighs, the inner thighs, underneath the chin, sometimes the arms. Those are all areas where liposuction can also be used. I'd like to also point out that neither tummy tucks nor liposuction are intended as weight loss surgery. These are procedures that you've done or do after you lose the weight. And typically we like people to have kept that weight off for at least 3 months before operating. So I hope that helps to clarify, when do you do liposuction of the abdomen? When do you do a tummy tuck? Thanks. And if you should consider having one of these procedures, please consider us here at West County Plastic Surgeons, Washington University in St. Louis, Missouri. Have a great day. Thank you.